There are currently 927,000 Australians who qualify for a government benefit worth up to $3,000 annually. They meet every eligibility criterion. The benefit is sitting there, available, waiting to be claimed. Yet the vast majority of these people have no idea it exists. I'm not talking about some obscure tax loophole or a complex investment strategy. I'm talking about the Commonwealth Seniors Health Card, a government-issued card specifically designed for self-funded retirees who don't qualify for the age pension. The benefits are substantial, the eligibility criteria are straightforward, and the application process takes roughly 20 minutes. Yet Services Australia estimates that fewer than half of eligible Australians actually hold this card. We are on a mission to reach 10,000 subscribers to build a community that is aware of these financial shifts. If that resonates with you, hit subscribe. What I find most striking about this situation is the profile of people missing out. These aren't individuals struggling to navigate complex bureaucracy or lacking the resources to pursue entitlements. These are self-funded retirees, people who have successfully accumulated enough superannuation or other assets that they don't qualify for the age pension. They're financially literate enough to have planned for retirement, yet they're leaving thousands of dollars in benefits unclaimed, often because they assume that if they don't get the age pension, they don't qualify for any government support whatsoever. That assumption is costing them money every single day, and the cumulative cost over a retirement that might span 20 or 30 years runs into tens of thousands of dollars. Let me walk you through exactly what the Commonwealth Seniors Health Card provides, who qualifies for it, and why so many eligible Australians remain unaware of its existence. The Commonwealth Seniors Health Card was introduced specifically to provide some measure of support to self-funded retirees who don't receive the age pension but still face healthcare costs and costs of living pressures. The primary benefit is access to cheaper prescription medications through the Pharmaceutical Benefits Scheme. With the card, you pay the concessional rate for PBS medicines, which as of January 2026 is $7.70 per prescription compared to the general patient rate of $31.60. For retirees taking multiple medications regularly, this difference is substantial. Let me put that in concrete terms. If you're taking 5 regular medications, refilling each one once per month, that's 60 prescriptions annually. At the general rate, you'd pay $1,896 per year. With the Commonwealth Seniors Health Card, you'd pay $462. That's a saving of $1,434 annually on medications alone. For couples where both partners take multiple medications, the savings effectively double. This is where the $3,000 annual benefit figure comes from. It's not hypothetical. It's the documented difference between what cardholders pay and what they would pay without the card. Beyond prescription medications, the card provides access to bulk billing for GP visits at practices that offer it to concession card holders. While bulk billing rates have declined in some areas, many GP clinics still bulk bill concession card holders, which means you pay nothing out of pocket for standard consultations. Without the card, you're paying the gap between what Medicare covers and what the GP charges, which commonly runs between $40 and $90 per visit, depending on location and practice. The card also provides eligibility for other Commonwealth concessions. You get the Senior Supplement, which is a small quarterly payment, currently $18.60 per quarter for singles or $28.10 for couples combined. It's not a large amount, but it's automatic once you hold the card. You're also eligible for the telephone allowance if you're receiving certain other payments, though this is less common. Critically, some state and territory governments provide additional concessions to Commonwealth Seniors Health Card holders. The specifics vary by location, but they can include discounts on energy bills, council rates, public transport, vehicle registration, and water charges. In some states, these concessions are substantial. In Queensland, for example, cardholders can access the electricity rebate and the South East Queensland pensioner water subsidy. In Victoria, there are concessions on energy bills and council rates. In New South Wales, cardholders qualify for certain transport and energy rebates. The exact value of these state-based concessions depends on where you live and what services you use, but they can add hundreds of dollars annually to the federal benefits when you combine the PBS medication savings, bulk billing access, and state concessions. The total annual benefit for many cardholders genuinely approaches or exceeds $3,000, particularly for couples who both hold cards and both take regular medications. So who actually qualifies for this card? The eligibility criteria are specific, but not particularly complex. First, you must be of pension age, which is currently 67 years. This is the same age threshold as for the age pension itself. Second, you must meet the income test, but not the assets test. This is crucial, and it's where the card differs fundamentally from age pension eligibility. The income test for the Commonwealth Seniors Health Card uses adjusted taxable income, which is different from the income test used for age pension. Adjusted taxable income includes your taxable income reported to the ATO, plus certain other amounts like target foreign income, total net investment losses, employer-provided fringe benefits above $1,000, and certain super contributions. For singles, the income limit is $95,400 annually. For couples combined, it's $152,640 annually, or $76,320 each. These thresholds are indexed regularly and increased on July 1, 2024. What matters here is that these are relatively high income thresholds. A single retiree can have adjusted taxable income of $95,400 and still qualify. For most self-funded retirees drawing down on superannuation in pension phase, the taxable income from their account-based pension is often quite low because of the tax treatment of super in retirement. Superannuation income streams for people over 60 are generally tax-free, which means they don't show up as taxable income even though you're receiving them. This creates a situation where a retiree might be living comfortably on $60,000 per year drawn from their super, but their actual taxable income for Commonwealth Seniors Health Card purposes might only be deemed income on any non-super financial assets, plus any employment income or other taxable sources. If most of their income is coming from tax-free super pensions, their adjusted taxable income could well be below the $95,400 threshold, even though their actual living standard is considerably higher. This is precisely why so many self-funded retirees qualify without realizing it. They assume that because they're living comfortably and don't need the age pension, they won't qualify for any government benefits. They don't understand that the Commonwealth Seniors Health Card has a completely different test, one that focuses on taxable income rather than total assets or total actual income. There is no assets test for the Commonwealth Seniors Health Card. You can own a home worth $2 million, have $800,000 in superannuation, hold investment properties, and still qualify as long as your adjusted taxable income is below the threshold. This is fundamentally different from the age pension, which has both an income test and an assets test, and most self-funded retirees are excluded from age pension by the assets test, even if their income is modest. The lack of an assets test for the Commonwealth Seniors Health Card means that asset-rich but income-poor retirees, which describes a significant portion of Australian self-funded retirees, are exactly the demographic this card is designed to support. Yet they're the least likely to apply, because they assume their asset position disqualifies them. Beyond the age and income requirements, there are a few other criteria. You must meet residence rules, generally meaning you're an Australian resident living in Australia. You cannot be receiving the age pension or certain other income support payments, though you can receive some Department of Veterans Affairs payments and still qualify. If you're a member of a couple, your partner also cannot be receiving age pension, though they can hold their own Commonwealth Seniors Health Card if they meet the individual criteria. The application process is straightforward. You can apply online through your MyGov account linked to Services Australia, or you can apply by phone or in person at a Services Australia office. You'll need to provide your tax file number and consent to Services Australia accessing your Australian Taxation Office income information. This is how they verify your adjusted taxable income. You may need to provide identity documents if you're applying for the first time and Services Australia doesn't already have them on record. The assessment is generally completed within a few weeks, though processing times can vary depending on whether additional information is required. Once approved, the card is issued and valid for 1 year. It's not a permanent entitlement. You need to reconfirm your eligibility annually because your income circumstances might change. Services Australia will contact you before your card expires to remind you to reapply. What I find particularly problematic is how little awareness exists about this card among the exact demographic it's designed to serve. I've spoken with financial advisors who specialize in retirement planning, And many tell me that they regularly encounter clients in their late 60s or 70s who have never heard of the Commonwealth Seniors Health Card. These are people who have engaged professional financial advice, who have structured their retirement carefully, who are monitoring their superannuation drawdowns and managing their age pension assets test position, yet somehow this benefit that they clearly qualify for has never come up in their planning. Part of the awareness gap stems from how the card is positioned in government communications. It's not heavily advertised because it's not means-tested in the same way as age pension, and government is generally cautious about promoting take-up of benefits that increase expenditure. The card tends to be mentioned in materials aimed at people who are exploring age pension eligibility and discover they don't qualify, at which point they might be directed to consider the Commonwealth Seniors Health Card instead. But many self-funded retirees never explore age pension eligibility in the first place. They know their assets exclude them, so they don't engage with Centrelink or Services Australia at all. They're not looking at government benefit websites. They're not attending seminars about age pension maximisation. They're simply living their retirement, paying full price for medications, and missing out on benefits they're legally entitled to. The cost of this awareness gap is borne entirely by the individuals who miss out. For someone taking multiple regular medications, the annual cost is well over $1,000. Over a 20-year retirement, that's $20,000 or more in additional medication costs that could have been avoided. Add in foregone bulk billing, missed state concessions, and the lost opportunity to use those saved funds for other purposes, and the lifetime cost of not holding a card you're eligible for can easily exceed $50,000 for a couple. What makes this particularly frustrating is that there's no complexity barrier. The application genuinely takes about 20 minutes if you have your tax file number and basic identity documents ready. The income test is assessed automatically through ATO data sharing, so you don't need to calculate your adjusted taxable income yourself or provide extensive documentation for something that takes less time than a routine GP appointment and can save thousands of dollars annually. The cost-benefit ratio is overwhelmingly favorable. The behavioral economics here are interesting. People tend to undervalue small, frequent savings compared to large one-time gains. Saving $24 per prescription doesn't feel significant in the moment. It's only when you aggregate it across multiple medications, multiple refills, and multiple years that the true value becomes apparent. This is similar to how people undervalue compound interest or small regular investment contributions. The benefits are distributed and delayed, which makes them psychologically less salient than they should be given their actual financial impact. There's also an element of identity. Many self-funded retirees take pride in their financial independence, in not needing government support. The idea of applying for a concession card can feel inconsistent with that identity, even though the Commonwealth Seniors Health Card is specifically designed for people in their exact situation. It's not welfare. It's recognition that even self-funded retirees face healthcare costs and that providing some measure of support for those costs is sound policy that promotes health outcomes and reduces pressure on the healthcare system. For policymakers, there's a tension between wanting eligible people to access benefits they're entitled to and not wanting to promote take-up in ways that increase expenditure. From a public health perspective, having more seniors access cheaper medications through PBS concession pricing is positive because it improves medication adherence and health outcomes. When medications are expensive, some people skip doses or don't fill prescriptions, which leads to worse health and potentially higher downstream costs through emergency department visits or hospitalizations. From a fiscal perspective, every additional Commonwealth Seniors Health Card issued represents increased expenditure through PBS subsidies and various concession programs. The government pays the difference between the concessional rate and the general rate for each PBS prescription. When cardholder numbers increase, so does that subsidy cost. This creates an incentive not to actively promote the card, even though every person who qualifies is legally entitled to apply and receive it. What this means for eligible retirees is that you cannot rely on government proactively informing you of your entitlement. The responsibility sits with you to be aware of what benefits exist, assess whether you qualify, and take the initiative to apply. This isn't unique to the Commonwealth Seniors Health Card. It's true across most government benefits, but it creates a systematic disadvantage for people who are less engaged with government services, less digitally connected, or simply unaware that benefits targeted at their demographic exist. The solution, to the extent there is one, operates at multiple levels. Financial advisors working with retirees should be routinely assessing Commonwealth Seniors Health Card eligibility as part of retirement planning. It should be standard practice to ask clients over 67 whether they hold the card, and if not, whether they've assessed their eligibility. Super funds communicating with members approaching or in retirement should be including information about the card in their materials, making members aware that even if they don't qualify for age pension, other support might be available. Community organisations working with seniors should be including Commonwealth Seniors Health Card information in their education programs. Pharmacists who directly see the cost impact when customers pay full price for medications could be empowered to mention the card to customers over 67 who are paying general rates, though there are obvious privacy and scope of practice considerations there. Ultimately, though, the responsibility for applying sits with the individual. If you're 67 or older, not receiving age pension, and your adjusted taxable income is below $95,400 for singles or $152,640 for couples, you almost certainly qualify for the Commonwealth Seniors Health Card. The application takes 20 minutes. The benefits start immediately upon approval. The annual savings can genuinely reach $3,000 or more, depending on your medication needs and what state concessions you access. The question isn't whether it's worth applying. The cost-benefit analysis is overwhelmingly clear. The question is whether you're willing to spend 20 minutes to check your eligibility and submit an application for a benefit that could save you thousands of dollars annually for the rest of your retirement. For the roughly 927,000 Australians who currently qualify but haven't applied, that 20 minutes represents one of the highest return time investments they could possibly make. Every day that passes without the card is another day paying full price for prescriptions, another GP visit without bulk billing, another quarterly energy bill without available concessions. The benefit is real, the eligibility is broad, the application is simple, the only barrier is awareness, and you now have that. What you do with this information is entirely up to you, but the cost of inaction is measured in thousands of dollars annually, compounding across what could be decades of retirement. For something this straightforward with returns this substantial, there's no rational reason to delay. The card is there, the benefits are waiting. The only question is whether you'll take 20 minutes to claim what you're already entitled to.